Some emergency medical services in South Jersey are operating in crisis mode. The Professional Firefighters Association of New Jersey says it's due to a surge in call volume and a major staffing shortage. Our Kelly Rule live in Camden tonight to break it all down. Kelly.
Well, Jason, at times this means that ambulances cannot be in service due to that staffing shortage, and that means other neighboring departments have to jump in. That takes a toll on them. We're told there's also a shortage of workers at hospitals, which means sometimes ambulances are waiting outside with a patient to transfer them for at least 45 minutes or worse.
Right now it is a crisis.
James Lyons, the 4th District Vice President with the Professional Firefighters Association of New Jersey, says the current status of emergency medical services in New Jersey needs attention now.
If you're in crisis mode or somebody's in cardiac arrest, you need people there right away.
And Lyons is concerned that's in jeopardy. Currently in New Jersey, EMS is not considered an essential service. While some municipalities like Cherry Hill have career EMS staff at the fire department, others may outsource from a private company, which often includes part-time workers. But Lyons says that's becoming an issue when there's a staffing shortage industry-wide and call volume is high. At times it means certain towns can't staff an ambulance, so a neighboring one needs to step in.
The larger communities will always say yes, and they always will help.
But it's taxing.
But it's taxing on everybody. As long as an ambulance shows up at the house, sometimes people are like, that's all they're worrying about. But is it the right ambulance? Or are you waiting, an increased amount of time?
Speaking of wait times, Lyons says the staffing shortages grappling hospitals right now is leading to a much longer turnaround time when transferring a patient from an ambulance to the hospital.
They may be at the hospital 45 minutes, 30 minutes, could be longer. And now that's taking that resource away from that community.
Lyons says they are scheduled to meet with state legislators next week, a big first step. He doesn't know the solution, but knows this.
Everybody has to sit at the table and have this conversation. It's not going to go away.
And Lyons told us today that one New Jersey town between January and September had 660 hours where an ambulance was not in service. He would not comment on where this was, but this is one example, a dire example of why this needs immediate attention. And again, Jason, they hope it will get that attention next week.
All right, Kelly Rule live in Camden for us. Kelly, thank you very much.